So speech-language pathology is a profession that encompasses way more than what most people think when they hear the term speech-language pathology. We work with kids and adults of all ages, and we work to diagnose and treat a variety of communication issues, swallowing issues, cognitive issues, and even more than that. So just a brief overview of the aspects of our field and profession. So speech includes the way that we say our sounds, and we help individuals to overcome those pronunciation issues to help them be more understood by other listeners. We also help individuals who stutter find a way to maybe overcome that stutter, or even find strategies to cope with the stutter and decrease the frequency of stuttering to help those individuals become more fluent. And then voice is another aspect where we try to help someone with maybe a vocal impairment gain their voice back or rehabilitate their voice to a more functional level. So language treatment is spread out over 3 different aspects. So one being receptive language, the way that you understand things and perceive things and process everything that is spoken to you. And then 2 being expressive language, so the way that you express yourself and communicate your wants and needs and your thoughts in a functional way using words, conversation skills, and things like that. And then 3 being pragmatic language or social language. And we most commonly see this in the autism population. So we help kiddos understand and find different ways to interact in their social environments appropriately. So maybe interacting in their home environments, their school environments, and even their work environments when they get older, just finding those appropriate ways to interact. The feeding and swallowing aspect of our profession includes diagnosis and treatment of any kind of impairment that may be hindering someone's ability to consume regular foods or receive proper nutrition. So we kind of help to find the problem and then rehabilitate that problem for a long-term solution. So the cognitive aspect of our profession includes treating any cognitive impairments that may be affecting that cognitive communication. So maybe your ability to attend to a task, the way that you perceive and process what is spoken to you, organize your thoughts in an appropriate way, remember information that's necessary to kind of carry out those day-to-day activities and reason and problem solve through your day. Typically, children who need to see a speech therapist aren't meeting their developmental milestones at the correct age. So maybe a kiddo is 15 months of age or older and they haven't said their first words yet, or maybe an older toddler, 3 years or older, isn't being understood by others because of mispronunciation issues. And those are just kind of the most common ways that kids need to see a speech therapist. As children grow and develop, there's a good chance that those pronunciation issues will resolve on their own. However, there are some instances where kids maybe 3 years or older are still mispronouncing some sounds, which is making them hard to be understood by others, which kind of affects that successful communication. So that's when we would start thinking about the need for a speech-language pathology evaluation. So anytime your child is evaluated by a speech-language pathologist, we do what is called an oral peripheral exam. And what that is, it's totally painless to the child, but we would look inside their mouths and just kind of examine all of their oral structures to make sure that there's no structural abnormalities or weaknesses that could be contributing to a speech impairment or even hindering that further speech and language progress. So if you even have the slightest concern as a parent that your child may need to see a speech-language pathologist, I would encourage you to discuss that with your child's physician, and you guys as a team come up with maybe the reasons why they may need to see a speech pathologist, and then your physician can send over an order to our facility, and then we can call you guys and get that evaluation scheduled. Those early years of development are just so critical, and early intervention is usually the best bet when it comes to speech-language intervention. So the earlier the better. The best piece of advice I could give you is just to trust your parental instincts because you're your child's biggest and best advocate.